Are you right wing or left wing? Um, my favorite wings are, um, honestly, I really like buffalo
I,
wings.
I got a Duke's brown arrow for you, David. You told me to grab a drink.
Hell yeah. Well, light's a little bright, but creature comforts.
Here's comfort. Okay,
I
nice.
just got Stella's, but
Can you guys see me okay?
Yeah, you're good,
Perfect.
man. Yeah, so I mean, so y'all are both basically like, well, I know Robert, you started your own company. Brian is your
yeah,
company
me
like
too.
taking off?
We're trying. Yeah, Chill Systems. We did a Kickstarter about 2 years ago, summer 2018, and we were successful with that. We raised like 53,000, and we've been building ever since.
Oh, gotcha.
The business
What
is
kind of
called Chill
business is it?
Systems. Called Chill Systems. Yeah, we make a cooler alternative.
Okay, you have one?
Yeah, the chiller.
Oh,
You can put a bottle of wine in here, or 3 beers, or whatever else up there. So this actually goes in the freezer.
Okay.
So it's like just it's a legit drink chiller. You can put a
Where do
bottle
you
of wine
order
or
one?
beers
I'll order one to support you guys.
on my website, man. Chill.systems. You go anytime.
What is it? Chill.systems?
Yes, sir.
Yeah,
I appreciate that.
There's like backpacks and stuff that go with like carrying bags, so you can take it out. Like,
Yeah.
if you wanted to go camping or whatever.
Yeah, we got some new stuff coming out this summer. It's pretty fun, but yeah, we sell on e-commerce. We're working our way into some retail businesses. Well, I'll talk more about that. That's been challenging this year.
Absolutely.
But
are you going to go through round 2 of funding?
We're working on it. We're trying to raise money all the time. If any investors want to come on board and are listening, hit me up. But yeah, we're definitely trying to raise some capital. We're working our way, hopefully trying to be on a TV show this year, one of the business TV shows. So we'll see if we can make that work. But yeah, we're doing what we can to get the word out.
Awesome.
Yeah, and then Robert, you started a dental company last year, right?
Integrity Dental Services, correct. Yeah, we're a full service dental laboratory, really focusing on the implant side of things. Implants in the dental world have really taken off in the last 10 years. And the digital aspect is really cool, the arena. And we're milling with CNC machines and doing 3D printing. So the digital space is really, it's allowing us to touch a market that we normally couldn't. Like, we're servicing the West Coast at the same time we could if we were a local vendor there while we're here on the East Coast. So we've been able to build a platform now, nationwide because of internet, e-commerce, 3D printing, just the digital world we're in.
Yeah.
And that really was a key to getting through COVID.
Being able to do the digital side.
Correct. Because we were able talk with doctors, treatment plan cases remotely, and do like we're doing now, with a patient. A patient doesn't have to be in the office. They could already have their scans done of their mouth. The doctor sitting at home can do the treatment plan via Zoom, just like we're doing now.
Yeah, I'm trying to find, I think I got a screenshot of it on my phone. I was looking at just different unemployment, basically, and it was specifically about with the healthcare field. And it was like the dental side of the
2 million people in dental.
Yeah, that's fucking crazy.
Crushed.
Jeez.
Yeah.
2 million people in dental were applying for unemployment. I think, what was the final number I saw right now? Around 33 million Americans, I think.
I think it's around 40 now. 40 million.
40
it's
now.
like, yeah.
Wow.
That's a little.
It was a few weeks ago I saw, but they said.
I was going to say it's a little misleading at this point. I read an article this morning I sent to David. It's the repeat unemployment claims. So the people that filed and refiled is 21 million now. Okay. So that they think that's a more accurate number of like the people that are still out of work. But yeah, it's 41 million have filed at this point, and then 21 have filed again.
Yeah. And that can take into account people that were like temporarily furloughed and stuff like that. So maybe they lost their job for a little bit, and then
there was a lot of furlough in the dental field. A lot of furlough, hygienist assistants, they came right back.
The one that I was looking at said that It doesn't really go into detail about what, because this was like just off like a CBS News website thing. They had a graph where you could like an interactive graph where you could like look at different areas of the healthcare field that have lost jobs, and it says they're down 53.2% since January for dental offices. So I don't know if that means like actual dental offices have shut down or 53% of employees lost their job or what, but it's pretty crazy.
Wow.
That's very high.
Yeah. And that's something that, I don't know, there's so many things with this that like people don't think about. One of the podcasts I was listening to, it might've been the NPR one, but, they were talking about how like pretty much historically these type of recessions and stuff like that usually impact males worse because, you know, traditionally men were the people that worked. But now since more women are in the labor force and also the type of jobs that are being affected by it, like hospitality jobs, healthcare jobs and stuff like that, women are actually like disproportionately getting the brunt of this. And now when people are able to go back to work, it's going to hit them again, because if, you know, assuming you're in a marriage and you have to decide between who's going to go back to work, you know, women usually get the shit into that stick. So I mean, that's just speculation, but I mean, more than likely, you know, more women are going to end up at home having to take care of the kids while the man has to go back out and work or whatever. But
yeah, it's the problem with daycare, and then obviously doing schooling from home. I mean, not many people have the luxury of having, you know, a nanny or someone that can just watch the kids. Either the man or the woman has to stay home, like you said, and then it's, who do you pick? The one that has the higher income, the one that's better suited to take care of the kids? There's just so many things that go into the equation.
Yeah. Well, because women are also are being laid off more than men right now too, because of the hospitality and leisure fields losing unemployment and healthcare fields losing unemployment more. They're more likely to be the ones that are unemployed when it's time to get back to work anyways. So
absolutely,
it's like,
it's a ton of service jobs, right?
Exactly.
It's all the stuff where people interact everywhere. People go and interact with each other, right? It's like, how can you, and then they talk about reopening, but only at like 25% capacity, right?
Yep.
And it's like, that doesn't work.
Like the problem like we had when Kemp went about the way he did opening, you know, people think on the news, and I have people in other states like, oh, we heard Georgia's open. It's like, well, yeah, we could open, but during phase one, the dental laboratory, like we were, with the restrictions we still had, we could only have 10 people in the building. We had to practice social distancing, and it's like we're approaching 100 employees now. So that if we're down to 10 during phase one, I only could have 10% of my workforce there.
Yeah. So how does that work?
So misleading.
If you can only actually have 10 people working, do the other 90 people still qualify for unemployment? Or
we didn't lay anyone off. I thought about it, prayed about it, and I wanted to get an ROI from my employees, meaning that, you know, the employees are an important part of the business, and I want them to believe in the culture, believe in integrity. I want them to come back strong, because what we do is such a unique field. You can't just plug and chug people. We spent a lot of money training them. We spent a lot of money on the equipment. So if I laid them off and they decide not to come back, or they don't believe in the company, it's not the company that put them first, it really is going to screw me long run. So we decided to burn cash to maintain them. Even though they stayed home for 5-6 weeks, everyone got paid their full pay, no pay cuts, anything. And now that we are back, I mean, dude, they're drinking the Kool-Aid, they're working extra hours, they're ready to go to war for the company.
That's awesome.
Yeah, it was tough. Yeah, don't get me wrong, as a business owner, especially being open 9 months, but I think it was the right thing to do long term. And these people now, I mean, they're loyal, and I can't tell you. And I thought, if I can keep one person from not committing suicide, one person from not going home and drinking, beating their wife, their kids, their husband, arguing, domestic violence, whatever the case may be, because people don't realize in this country how much pressure and stress financially is put on households, and they bring it home. So even if you got, little Johnny over here is 8 years old and he's just wanting to play with dad, but dad just lost his job or took a 40% pay cut. It's human nature to be in a bad mood, take it out on. So if we can help lower domestic violence, not contribute to suicide, we're not contributing to unemployment rates, which obviously unemployment assistance is not bad considering the other two alternatives. But I just feel like it was the right thing to do.
I guess everybody isn't in a position to do that, but the fact that you found a way to make it happen, that's really admirable. That's awesome. But
as I tell people as a business, I mean, you want to make a profit. Cash is king, but you make a profit for distributions and earnings, but also too, you save cash for emergencies. If this isn't considered an emergency and a time to burn cash, I don't know what is.
True. Yeah. And
So
it's kind of crazy
fortunate to have capital on hand to be able to do it.
Yeah, that was something that kind of was like mind-boggling to me, that these massive corporations that got these bailouts and whatever through the stimulus package, like that was really early on. These are the companies that should be big enough that they can set themselves up for this. Exactly what you're talking about, like have emergency funds and stuff.
I turn that right back around too. Each state I look at as a business. How can a state not have enough operating capital on hand to get through a 2-month crisis? How can a state say, oh, we're about to be bankrupt 45 days in? That is a bigger problem at hand. What's going on with the tax dollars? Because why? Yeah, I mean, I'm trying to think the best way to put it. Businesses get help. There's bailout, whatnot too. But how can a state not have enough funds on hand to operate for 2 months? I just don't understand that.
Brian, did you have something to say about it?
I was just going to say, everybody's operating on credit at this point, right? The individual, the corporation, the state, the country, like everybody, right? It's just a bunch of debt on the Fed's balance sheet. And I don't know how that ends. I really don't. Like, it is kind of scary, I'm not like a fear monger, right? But it's an untested experiment. Like,
well, we're printing
what this looks like. Yeah,
we're printing money right now that's not being backed by gold. I mean, so
we're printing a shit ton.
What's going to happen to
and not
the
even
US dollar?
Not even printing it, right? Just digitizing it, and just sending it, like with Trump's signature on some of it, right? But
I mean, the whole PPP program, the way it works, I don't know if you guys are familiar with it for the small business, but basically your local bank or your bank does the underwriting. They take you through the whole process and then they submit it to the SBA. So if there's a problem in the underwriting, then that falls back on the bank. So everyone's like, oh, the government's issuing the money. That's not the case. The bank's issuing the money. The SBA is just guaranteeing the money. But like me as a small business, we did qualify for a PPP, but we didn't get the amount we should because we hadn't been open a full physical year. But now every week we're getting new guidance, emails from SBA.gov saying, hey, these are the new requirements. This is the requirement for forgiveness. It's changing like the wind. And, there's different sectors, like you hit the nail on the head, like a restaurant. They can't be at 100% capacity. So you're going to force them to use the PPP to pay their employees, but yet they can't bring their employees into work. And if you're not operating at 100%, then you're not driving revenues. So all we're doing is putting a Band-Aid on the problem, because I think at the end of the 60 days or 8 weeks of PPP, all we're going to do is see a spike in unemployment because people are paying their employees right now through a government-assisted program. And if you fire someone or they have to make at least 75% of their average wage, then it's forgiven. But then at the end of those 2 months, if business isn't there and revenue's not up, they can't maintain. Really think end of June, you're going to see a big spike in unemployment.
Yeah, I think that makes sense. I mean, I think one thing I do want to say is like we have a really good trajectory going right now, and I think that's partially due to people taking it serious now, as like 2 months ago they weren't taking it seriously at all. So now, even though we're in phase 1 and we're starting to open up, people are still wearing masks, and they're like, okay, well, we still need to like do the social distancing thing. Mm-hmm. So hopefully,
are people wearing masks a lot in Georgia still?
Oh yeah,
it depends on where you're at, but yeah, I mean, when I go out, I would say at least half the people wearing masks. Not everybody does, but.
But see, like I have a buddy who owns 5 restaurants here local, and he got PPP, so he kept the whole staff, and he's allowing them to rotate like every other day or every third day on a shift, because like every other booth is closed. They basically have a third of their seating capacity in the average restaurant. But he has to pay those people in order for the PPP to be forgiven. But he's already told me at the end of the 8 weeks, he's going to let go 66% of his workforce because the restaurant is only at 33% capacity. So what does that do long term?
Yeah. It's not sustainable for sure.
Yeah, it's going to wreck a lot of small businesses is what's going to happen long term, right? I mean, there's no way around it. That's what the public policy is doing. You know, whether it's worth it or not is the debate, right? But that's what's going to happen. I mean, you can't tell a business not to operate for a long time. Businesses aren't made to not operate.
And like I said, I mean, especially the brick and mortar that are already paying rent and leases based off the square footage of what their capacity was. You can't scale back to a third overnight, and then you're still stuck in the same building with the same rent, the same lease, and the landlord can't take it on. So, I mean, it's a domino effect.
Definitely is.
Yeah. So you asked about Georgia. Brian lives in California. So what's your experience been like out there? And you're in what, Los Angeles?
I'm in Los Angeles. Yeah.
Okay.
People take it super seriously out here. So California actually had a head start a little bit, because if you remember the like cruise ship that came back into Oakland, it was like one of the first coronavirus things that actually hit the US.
Right.
I think there were like a couple cases in Washington first, and then that Oakland ship came in. So California was actually dealing with it early on. Like Newsom was on it before Trump, basically. And then they started working together, and that was kind of like the administration's first like actual doing something. like the Trump administration kind of like walked around it, and they did the China travel ban. But after that, they didn't really do anything until like kind of like March, I think. So, yeah, California was kind of in it early on. So the California ban, I think, was one of the first ones. Like we were on a stay-at-home order very early on. It was like before, I think, the national one that happened like on the 15th of March or something like that.
Yeah.
Yeah. So it's all good. I mean, I think it just depends on what people's experience. Like mine, you know, I already work from home, so it's like it didn't actually affect my day-to-day life that much. Like I just go out less now, and when I do, I wear a mask, right? But everybody wears a mask pretty much. Like I don't see people not wearing them out here.
Okay. Is Chill System is that what you do like 100% of the time, or do you work and do Chill System on the side?
No, Chill Systems is my main gig for sure. But I also do some startup consulting with some other businesses, helping them, you know, get their pitch deck and financials in order and ready to like pitch to investors, basically.
Okay. Have you taken a hit with that, or has that actually gotten better, or what?
I've actually been lucky. My consulting's been ramping up. Chill Systems has definitely been taking a hit. Like we were supposed to be at trade shows this summer and spring, like promoting our brand and trying to sell into retail for holiday next spring, next summer, basically. So we were supposed to be at the Housewares show, the International Housewares show in Chicago in March. We were supposed to be at Outdoor Retailer in Denver in June, and like the hardware show in Vegas in I think May or something. So we had all those were canceled. It was like March 2nd, I think the Housewares show was canceled because they have people coming in from China to like be suppliers at the show. And so because of the travel ban, they had to cancel. And so that was like 2 weeks before the national ban. So we had kind of a heads up that all this was coming. We were like watching it affect stuff before it started being like national news every day. And so it was kind of weird. Like we saw that happen, and we were trying to figure out how to get around, like what to do instead, right? Do voicemail drops to potential customers if we can get a call list or something, or, you know, try to still reach out to people in the industry, even though we weren't going to be able to meet them at the trade shows. So, you know, we had money sunk into those things, into our booth materials, into our travel and everything, right? All the payments to go to the trade shows are, a few $1,000s or more each time. So some of that's just sunk, and they're saying, oh, next year you have a free booth.
Yeah.
Thanks. Right.
How many employees do you have for Chill Systems?
There's the two founders, and Ariana is our social media manager and photographer. It's
So
just the three of us right now.
Okay.
Yeah.
Well,
We have a lot of contractors.
you don't have to worry about
with,
too much. Like you don't have a bunch of employees to pay.
No, we're lucky. We have low overhead. Like our business is really just, it's tough because next season is taking a hit because we can't sell into, they do the planogram for retail stores like 9 months out or 12 months out. Right. So they're starting to plan this summer, like that we would be selling for next year. And so we're missing out already on next year's sales. Right. And then we can't meet those people now. And so it messes with our scaling a lot. We're trying to scale up and sell more units and work our way into bigger and bigger accounts and sell more and more units and produce more and more, right? And get the cost down and all that. It's like
you
really
have a lot of inventory on hand.
We don't have a it's We've done good about it so far, or done well with it so far. We've managed it well, but it's definitely messed with us a bit. We had to change our whole strategy for how to try to get into the market. And next summer, what's going to happen is this summer people aren't shopping as much and stores are closing. So there's a bunch of inventory backlogs now in all the retailers that we would like to sell our stuff into. So they're not buying as much summer stuff, even for next summer, as they would have, right? Because they have all this inventory backlog. So it's just kind of a mess. We're maneuvering around. We're going into smaller gift shops. We're going to specialty retailers, right? We're just trying to find different ways to do it.
What about pushing e-commerce though? I mean, are you not going to use?
We're still running e-com. We've been doing that since we started, so that's fine. It's but it's people have been told to stay at home. Our product is like get out. It's social. It's like outdoor, portable, cold drinks. Like get out and go on a hike or whatever. So it's
go hang out with people outside.
Go hang out with a few friends outside.
Exactly what you're not allowed to do right now.
Yeah. So it's a little insensitive. We felt to be like pushing marketing a lot, especially for us right now. It's kind of like you're not really supposed to do that. Even some of our photos, right? Old photos that we want to post, we're like, probably shouldn't post that. It's a group of people. People might not get it that it's old, right? So it's just weird. It affects everything.
Yeah, I'm thinking about when you did your startup. I remember like people like out like maybe at a picnic or something like that. Mm-hmm. And that's definitely not something you can really.
This past weekend here in Georgia, and especially in the South, people were out like crazy. Lakes, beaches, outside, parks, pools. I mean, it was like the switch flip this past weekend.
There's going to be a spike in cases for sure. And this fall, it's definitely going to resurge when it gets cold again. But
it's
going to be a
chart that I was looking at earlier that was like health data. They were predicting right now that it was going to pretty much like just keep dropping until early August. And then it kind of plateaued to where like it looked pretty safe, but it didn't go past August. So it doesn't take into account what you're talking about. I know Fauci
second wave.
Yeah. Fauci has talked about, kind of like flu season, takes off in the summertime. If it reacts the same way, I haven't really looked into that. If it's,
as far as I know, it
seasonal,
spreads the same way. I don't know if the virus would react the same way, but the way it spreads, which I think would have something to do with how much it spikes in those times.
Well, it just depends on how well it survives during like heat.
Yeah,
basically,
the heat's definitely key, and I think the guidance too now coming out, especially changed a lot for us in the dental operatories and the way we had the regulation from the CDC and the ADA, American Dental Association, with it not living on the surface like they thought. 7 to 8 days has changed big time.
That's actually that's a pretty big point to bring up actually, because I know we do pretty much all of our shopping online, have all our groceries shipped to the house and stuff like that. Yep. So we don't even have to, for the most part this entire time, we haven't even worried about having to go out in the public because most of the stuff you can just get online now. But even when we get it delivered to the house, like spraying Lysol or like wiping with Lysol wipes and stuff like that. But now CDC is like, you don't really have to worry about it. It's
exactly. I mean, the guidance changes so fast.
Yeah. don't wear a mask, wear a mask. It's like the flu. It's not like the flu, right?
Hot, cold, black, white.
Yeah, but Fauci has said that he thinks it might drop off similar to the flu does, but then it'll resurge in the fall. And the biggest problem with that is that we still have the flu. And if they both spike at the same time and they both have the same, like you can get pneumonia and things that require ventilator treatment compounding on each other, then that's really going to be an issue for hospitals. Mm-hmm. But it's all speculative right now, though.
A lot of people, I've talked to a few like medical people, nurses and others, and the sense I've gotten is people think that it was spreading and like already kind of that was happening this winter, basically. Like COVID was already kind of spreading, and some hospitals were dealing with COVID patients and just didn't know it. Because it was already, they thought it was like an excessive flu season already this year, and that I couldn't identify them all as flu people. So I don't know the exact numbers on that, but some of the people I've talked to think that it's like potentially that was the case. And I think we do already know there were confirmed cases here before, March for sure, right? In like February, January. So I don't know. It's kind of weird. I don't know if it was the hype of what was happening and when COVID started here was actually when it started. Or like if, you know what I mean? Like the cases that we're tracking, was that just when we started tracking cases, or was that?
I think that's what it
actually
is.
when the cases started, right? Like
we didn't start testing. Like it's the first case or whatever, the first positive case.
Right.
Like it finally hit America. I think it was more than likely it was already here. We just didn't know it because we weren't.
So that's what
100%. It had to be. There's no way to pinpoint exact one. It had to be prior.
Yeah.
Yeah.
And like my wife's a teacher, and I know like November timeframe of last year. I don't know if it was that early that it was already in. Like nobody knows, but but I know that last November her school had like a ridiculous amount of flu cases. I think multiple schools all over Georgia. Like they were even talking about.
But they were talking about a respiratory virus that was affecting respiratory that no one knew what it was. It was lasting like a week or two, and everyone thought, oh, it's just a bad virus going around.
Yeah.
Really?
And that was November, December of last year, all here.
Well, I know that it was they called it like a flu problem in Gwinnett County Public Schools, and my wife and all her coworkers they have like some kind of like commercial grade disinfectants and stuff that they were giving the teachers, and they were like, after every class you need to like wipe everything down and clean all that stuff because the flu was spreading. At least they think it was the flu. I mean, there was a lot of kids that did actually test positive for the flu, but I'm sure that there could have been COVID patients in there also. But yeah, I mean,
so how do you know?
It was bad enough in November that teachers, at least in Gwinnett, were having to take like extra measures that they've never taken before to wipe down, the entire classroom.
I remember there was a school here in Rockdale County. Actually, it closed for like 3 days for disinfecting because they said over 30% of the students had flu-like symptoms.
Yeah,
unreal.
Yeah,
so my sister's kids' daycare. She lives in New York, upstate New York. Her kids' daycare, I think it was in like January or February, had like something roll through that like everybody was sick and they didn't know what it was. So it's like, obviously this is speculation, but I don't know. It's like, doesn't seem to me that it's that crazy that it would have been here already. I don't know.
Yeah,
China was just on it in January, and I haven't
really heard any medical professionals come out and say that that's like a crazy thing to think either. Like I haven't seen anybody say no, it only came here in March or February or whatever. Like I think it's really plausible that it was here at least December. But
I mean, I got sick, really sick in mid-January, and then when COVID came out, I was like, man, that kind of seems like maybe what I had. But I
was sick.
I haven't gotten tested, so I don't know.
Yeah, I was sick from like Thanksgiving week till it lasted about 2 weeks, and then I had a chronic cough after that until Christmas. So I had a cough for an entire month, but I was like very, very sick for like 2 weeks straight, and then I got sick again in February.
Yeah, and also the flu. Like, isn't the flu kind of like Kleenex? Like, do people actually? How often do people actually go to the doctor and get diagnosed with the flu versus just like stay at home for a few days with flu-like symptoms and say they had the flu? Because I don't think I've ever been officially diagnosed with the flu.
Yeah,
but
well,
100%.
I've had it. Like I'm pretty sure I've had it, right? So
Everyone's like, oh, I'm at home. I've got a fever. My body aches. I'm at home. I've got the flu, but they
I've
never
got the
tested
flu,
it.
right?
yeah, true.
So
Yeah, me and my wife are complete opposites in that. Like I don't know why, but I always go to the doctor. Like if I get sick, I go. I guess because I just assume like if I need antibiotics, I would rather get them sooner than later. But my wife is the complete opposite. She's like, oh well, I know I get sinus infections a lot, so this is a sinus infection, and I'm not going to need antibiotics, so I'm not going to go to the doctor. So she never goes to the doctor unless she's like dying.
Yeah.
I always try to get rid of it first, right? Like stay home, drink some soup, whatever.
Yeah.
Try to let it go.
How you build a strong immune system.
Yeah. But anyway, I don't know. I'm just saying, like, I haven't seen any like good, real information about what we think. I haven't seen anything about the baseline of respiratory cases and how much the bump in respiratory cases was and how many were identified as the flu and where I haven't seen any good data on this.
I think a really good
actually breaks it down at all.
I think an easy indicator would be looking at how many people died of like like pneumonia and stuff like that. If there was a spike in like November, December, January, or similar stuff like that, or if there was an increase in elderly death at that time or something like that, because we already know that mostly 65 and up are the majority of the people that are dying.
Yeah. So anyway, yeah, it's wild. I don't know, but yeah, the effect on the economy has been nuts, man. Like so I remember very clearly it was like March 2nd, I said we got news that the trade show was canceled in Chicago. So we started like understanding what was happening. And then California started issuing orders to like stay at home and wear masks and things. We were okay. So now we see what's going on. And then it was March 11th, the NBA canceled the rest of their season. I remember that, or they suspended their season.
Yep.
I remember that very clearly. And it was like, that's when we started to take notice, right? It was like everyone in the US couldn't ignore it anymore when LeBron's not playing tomorrow.
Absolutely.
Right? So that was really, it was almost like Adam Silver shut down the US. Like he shut down the NBA and then everybody took notice and all big venues started closing everything. I had friends who were canceling weddings, but that was because they were, their wedding was like in March. It was my cousin's wedding was supposed to be in March. And so he had to cancel it, but that was like early March. Right. But I don't get this whole, I don't know. I don't get all this. How long can you tell people not to get married with their friends and family in attendance? Like how, you can't just have people's lives on hold forever. On some level, there has to be a do stuff at your own risk solution, right? Like there has to be, because there's no other way. It's like you're saying, if you come back at less than full capacity, restaurants going to close, like businesses are going to fire people if they can't pay with PPP. I don't understand how you can, airplanes aren't going to cut out the middle seat in every other row, right? It's not going to happen. So I don't know. I don't know how they're going to fix this unless they just say kind of like, take precautions, be smart. And, businesses can do what they can. That's been nice to see, right? Like Trader Joe's sanitizes my cart before I go inside now. They didn't do that before. It kind of makes me wonder, like, what did they do before? How often did they sanitize the carts before? Right? Like, I don't know.
I've always been one of those,
good.
Even when I travel, getting on an airplane, I take hand sanitizer and wipes with me because airplanes, even before you even knew what COVID was or coronavirus, like I wipe down my tray, my armrest, because they're the turnover on airplane, land, get them off, get them on, land, get them off, get them on. It's nasty.
So everyone should do that, right?
Absolutely.
So that side of it
sense.
Is good. Like we're getting a wake up call that we should all be better hygiene and like be much smarter, right? And businesses should do more to protect their customers. But actually keeping stuff shut down or partially shut down is a death sentence for tons of businesses. Like, I don't know. It's just, and especially people that are like working. I mean, if you're a person that can do your work freelance, honestly, you should start your own business. Like you shouldn't allow the government to do this shit to you. If you can cut hair or drive people around or whatever your business is, like start finding clients and adding them to your Rolodex and do it privately. You don't need Uber to drive people around, and you don't need great clips to cut people's hair. Like literally, I haven't got a haircut in however long. I need a haircut. I can't go get a haircut right now.
Yeah,
Like,
but the
places I
problem with
normally
that
go,
is if the government finds out, then you get your ass.
Well, they'll take your
Right,
license.
for
Like
it.
here, they're threatening to take your
See
life.
that?
You're caught. Like my girlfriend wanted to get her eyelashes done, and like they said, if they're caught doing that, then they can lose their esthetician or whatever you call it license.
Yeah.
I don't know the
That's
correct term,
unreal.
but it's true.
So I feel like that won't be after this. People
So
have
they're
to
scaring them
have to
into
wake
taking
up and-
unemployment. They have to take unemployment because they can't risk the alternative.
That's wild.
Yep.
Yeah,
That's
I'm with you.
this
How
is
can-
why you don't have communism, right? Like you don't
I mean,
want the government running
It's
everything
like this. It's
and telling everyone what to do.
Swimming in the ocean at your own risk. I mean, it's just the same thing. I mean, you could get in the ocean and drown, or you could get in the ocean and swim. You could go out and get sick, or you could stay home. I mean, at some point, it has to be the human's choice.
Yeah.
Right. And also,
with precautions.
What if you live with someone who's an essential worker? You can't quarantine. It's not a real thing.
No.
Right? Not everyone lives in situations where like their house unit can just be a unit and never interact with other people and not,
It's unrealistic.
Well,
the whole
and
the whole
aspect to
thing
that is now they're saying like if you look at the statistics of how many people are getting infected and where they got infected, there's a lot of like retirement homes and people that are confined in an area that they didn't catch it outside going to a bar or something like that. Like, they caught it being stuck in a place with other people that have it. And also like the way that the air flows in a house the virus doesn't dissipate in the air inside your house like it would if you're outside,
Right.
wind blowing and all these different factors and stuff like that. So it's actually, it seems to me like it's safer for you to be outside than it is inside stuck with other
I agree
people.
100%.
I think it is, right? It's just how much are you exchanging like bodily fluids with people, right? I mean, that's really what it is. Not getting sneezed on or touching something that got sneezed on. I mean, that's at least my understanding is that's how it spreads. It's like the flu.
Well,
It's
even
like
now the
talking,
CDC
particles.
Yeah, but they say if someone has the virus and they were to sneeze on like a shopping buggy or a counter and you touch that and then touched your mouth, you still can't get it. It's not, the particles
Really?
per million aren't strong enough.
yeah, but if you sneeze, like, so if we're in the same room and somebody sneezes, those I forget how they call it, but whatever, the water particles that are in the air that hold the virus, they stay in the air. They stay suspended in the air, like aerosol or whatever. And then you breathe that in. That's the danger, not like touching a surface. And
Correct.
So somebody sneezes on a grocery
Mhm.
cart, and you touch the grocery cart, like that's less likely to do something to you. But if you're in the same room as somebody at your home, you sneeze in the air, that air is stagnant in
Okay.
your house. So because the air is not free flowing like you are outdoors, those particles are just I think they can stay, the virus can stay like floating in the air for like up to 3 hours or something like that.
Wow.
So
Wow. Yeah.
don't quote me on that. I'm going to have to,
Yeah.
I might
I
have
don't
to
know
correct
exactly,
myself. Yeah. But it's something.
Like I said, I don't think anyone has the exact answer. No one has the correct solution, but I think the key is to use common sense, to use the correct precautions, regardless of anything. If you have a fever, don't go to work and be around your coworkers.
Right.
Try to work remotely. Use PTO. Use a sick day. If your kid's sick, keep them home from school. I mean, but prior to any of this, before you eat, wash your hands. If you blow your nose, wash your hands.
Cover your mouth.
I don't know.
Yeah. Sneeze into your elbow.
You can't
Yeah.
teach common sense. If you got to
Yeah.
sneeze, sneeze like this.
Right.
Yeah. Shit, I was going to say
But
something
yeah,
else.
I don't know what we're gonna do. This whole government run solution, I don't know that it works. For anyone,
the thing
really.
is, like, we need. Do either of y'all know like how much it costs to get a test done? I haven't been tested yet. Like either
I don't
for
know if it
like,
costs anything in California. I think you can like drive up and get
Before
one.
I thought.
yeah. So
No,
like for
part of the CARES One Act they put in, they can't charge for anything COVID related. The test they can't charge you for it. And if you have to have medical coverage in a hospital because of COVID symptoms or whatnot, you're excluded. There's no charge for
Does
the
that
nasal
include-
test or the antibody test.
That's what I was going to ask. Yeah, antibody. So you can get the antibody test for free then?
Yeah.
Okay, yeah, that's what I was going to ask.
Desired locations. There's other people, third parties, that are buying it and charging. But if you go through the CDC website at their designated areas where you go to be tested, you're not charged.
Okay, yeah. So that was my.
And
That's
you could
what I was
have
going to
Joe
say
Blow on
is-
the corner selling tests and charge you. But
Yeah, but I feel like that's the key really to opening back up, because like, you know, say you pick 10 of your buddies to get together and have a beer in your backyard or something like that. If all of you have been tested, maybe all 10 of you have antibodies or something like that, then you know that you've all had it and you've all built up an immunity to it. You don't necessarily even need to wear a mask or like stay away from each other, because for one, since you already have your antibodies built up, you probably don't have it right now. And also you've already built up an immunity to it. So there's not really the danger of you getting deathly ill from catching it or something. You know what I'm saying?
Yeah.
Or a regular test that just says like, do you have it or do you not have it? You know, that I feel like that would be a little bit better for, you know, if you wanted to not wear a mask.
I feel like the problem with the testing, like as a requirement to open back up solution, is like you can get tested and not have it and then get it
And then
and
catch
not
it,
know
yeah.
it, right? There's like asymptomatic carriers. So you could be test negative for having COVID and then get it and not know it and still have it later or be spreading it theoretically,
Yeah,
right?
for
So
sure.
it's like it doesn't get rid of the fear, right? That's the issue. It's like, it's not really the government. The problem isn't really the government telling you to stay home. It's ultimately people not wanting to go out. It's the government creating an environment where people don't want to go out, right? This whole like fear that they put into everyone, and where the businesses worry about their liability that they can't host an event, right? Like one of the companies I consult with, we do live events. We can't plan our events this year. Luckily, we hadn't already planned them and put money behind them, but we can't plan them now. I can't plan them for October, November, December. I can't plan for January, right? Like I don't know when I'm allowed to have an event of more than 10 people ever. Like there's no, you know, so it's the fear. It's like the fear that's making the governors do everything they're doing and the CEOs doing everything they're doing, right? That's really the issue. And I think what the clarity needs to be, how bad is the virus? What is the risk? So people can actually assess the risk for themselves and decide whether or not to go out or whether or not to open their restaurant, or whether, right? Like I think people should be able to make that choice for themselves. They should be able to say, I'm not scared. And so I'm going to go out. Right. And I mean, it's already kind of starting to happen, right? Disney World announced they're opening back up in July, I think.
July 10th or 11th, they said.
NBA is going to start having games again. Right. So I said from the very beginning, the NFL is not going to not have games. Like no way in hell in the United States of America, the NFL is canceling their season. So I was like, you know, that's bigger than church. Like they can't do it. It's not going to happen. And then churches, like they're going to have to come back online too soon, right? Like they're not going to stay at home forever. So I think
we have churches that are already open around here.
Yeah.
Yep.
So I think it's just one of those things where it's actually inhibiting your freedom of assembly, and people just aren't going to take it forever.
But if you get down and because I'm in the healthcare side, and I have a good friend of mine, his dad's the CEO of a group of hospitals, and we were talking about the numbers. And if you really strip down the data and look at people who don't have pre-existing conditions, don't have diabetes, and one huge contributing factor people are not talking about is obesity. Obesity is huge when you look at this. Someone like both of you guys, I can't say for certain, but if based off the data, if you got it, chances are, one, you probably would never know it, or two, it's like 99.998% chance you're not going to die from it. You may feel like shit and be sick, but you're going to be sick for a few days and move on. But whereas if your grandfather's 80 years old, he's got COPD or bad lungs from smoking for years, it could wipe him out. So we got to use caution and common sense, whereas, you know.
Yeah, and absolutely, we have to do that, right? I mean, and some of it is ridiculous. I mean, my grandfather was actually just in rehab for like his hip, I think, and he couldn't go home and be with his wife. He's in his 90s, she's in her late 80s, right? They've been together every day for like 65 years, and she couldn't go be with him at his rehab facility, and he couldn't go home to be with her because of COVID. And it was like unbelievable. I was just I don't know. I just couldn't believe some of the regulations. It doesn't seem like they're actually for people's safety. It's just like some of it seems excessive. And I think you're right that if you actually look at the data, you're probably right that there's no.
I mean, look at the data now that Italy's putting out off all the deaths and stuff they had over there now. 96% of the deaths they're saying all had pre-existing conditions, or
Wow.
some people were already labeled terminal before they even knew of this. I mean, it's crazy when you read the actual data. 96%.
So why isn't that more in the news, right? That's my question. Why isn't the actual data about,
I don't know if you want me to go off on
the
that.
jobs and the, no, really, but I think that's the issue, right? Is like people don't know. People don't really know how dangerous it is. Nurses know because they're in the hospital every day dealing with it, but regular people don't know. No one's telling them. And if they are, they're telling them it's like extra dangerous, right? It went from it's not dangerous at all on Fox News to like it's super dangerous and we have to do everything to stop it. And then like they're kind of going back to like it's not that bad, right? On the liberal media, it's been super dangerous the entire time. Trump's response, so bad, right? Once they decided that. But at first, they were still trying to impeach Trump and they weren't talking about coronavirus at all, right? Trump mentioned coronavirus in his State of the Union and Nancy Pelosi ripped it up. And that was what the news was about. It was about State of the Union and ripping up the State of the Union. It had nothing to do with coronavirus. They skimmed right past coronavirus, right? So we knew about it. Like it was happening already. And we didn't really respond until mid-March, basically because of politics. Like it wasn't really, I don't think, a healthcare driven decision. If it was, it would have happened in January. Like our lockdown would have started way earlier. They would have been telling people to wear masks and stay home if you can way earlier. Right. I don't think it was.
I think if it wasn't an election year, I don't even think it'd be that big of a deal right now.
Yeah. I also, another thing I think is like the orders that they told everybody to stay home, right? It's such a 2020 response. Like now that we have Zoom and we have cell phones and we have ways to stay in contact and still do some of our work from home, they say, some companies, tech companies and other, people say, oh yeah, stay at home if you can. But even 20 years ago, we wouldn't have done that, right? So like the idea that like we have to respond in 2020 fashion, right? Because it's happening now. It's like, we could be logical and reasonable and say like, what would we have done 10 years ago if the same thing would have happened? Or what would we have done 20 years ago if the same thing would have happened? We wouldn't have said, everyone stay home and don't go to work. Like, I don't think so. I really don't think we would have done that. I think people wouldn't have allowed it. They would have said, no way. Like the information wouldn't have spread the same way. People wouldn't have been as confident about it, right? It wouldn't have been as much of hysteria, I don't think. It would have been like more measured approach to handling it. But, it was like a truncated approach, just like we don't do much and then we just like do everything.
Yeah.
That was what was wild to me. And then companies started laying people off immediately, right? Q2 outlook was like down. And then it's like, well, if we're not going to make any revenue in Q2, then we shouldn't pay anybody in Q2. And they just started laying people off left and right. My best buddy from Brookwood got laid off immediately when this started.
I'm reading right here on cdc.gov. In 2009, H1N1, they estimated 151,000 to 575 people worldwide would die from H1N1 in 2009. Okay. And I'll tell you what the final number was, but in 2009, you guys remember this? Was anything going on like it is now?
Oh, no. And yeah, it wasn't going on like that at all.
And if you go on cdc.gov, which I have right now, same thing. Okay. 90% of the deaths then were people over 65. 70% were people with pre-existing conditions. So, I mean, I'm sitting here scrolling through reading these numbers. How can something in 2009 that actually, as of right, don't know what the final number for COVID-19 will be as of right now. 2009 was much worse than what we're going through, but yet look at the result, what we've done to the economy, to the supply chain, to people's jobs. I mean, I just don't understand. And I think the media is driving it. I'm sorry, but that's my opinion.
Yeah, I agree.
Well,
I agree with that completely.
I don't disagree that the media is definitely making things worse, but I do, You said that it was between 100 and something to 500 something thousand worldwide.
It said when it was first started, they anticipated that there would be 151. I have it right here: 151,700 to 575,000 people would die worldwide, and the number ended up. I just had it was 300 something thousand. We had over 160,000 alone in the United States. Let me pull it back up.
Yeah. So what I was going to say about that is we're already at that level now, and we've only had the virus for like maybe 6 months. If you think that it went back.
Yeah,
to
but
like
when the final
November,
numbers come
December.
out, they're saying the number that they're counting for the deaths. I mean, look at they had a police officer shot in Illinois 2 weeks ago, and they just showed up as cause of death COVID-19 2 days ago. I mean, the numbers are so skewed because the states are getting 30. If you're on a ventilator, you're getting $39,000 in government aid. Okay, if you die of COVID-19, not a ventilator, it's $13,000. Like the numbers are astronomical. My grandfather's in the Benton nursing home. Guy died across the hall from him. He's been there over a year. 91-year-old male. He's got COPD. Wakes up every morning coughing. Everything. Was never tested of the virus. Guy dies in his sleep. Cause of death, COVID-19. The number we don't know what the number actually is.
See, this is what I'm saying. The data is very muddled, and it feels like
so
it's that way on
skewed.
purpose, right? Yeah.
It's so skewed.
Could you do me a favor and send me the link to that police one?
Yeah.
I'm gonna look at that later, but yeah, I've seen. I mean, there's an argument on both sides. There's a lot of people that are saying that because the CDC has put out those guidelines for allowing people to put like a COVID death on the birth certificate or death certificate if they have certain symptoms and they've been exposed to the virus and stuff like that. People are saying that we're over-reporting deaths, but then there's also like a Harvard professor that talked about there's actually a pretty large possibility that we've been under-reporting deaths this entire time, especially considering if
it started earlier.
If it started earlier than we know, then obviously we've under-reported deaths, but also people that don't go to the healthcare, like we were talking about, people don't get checked for the flu or whatever. Some people just get sick and die in their house and never got checked in the first place. And like New York was, the biggest hotspot in the United States.
Mm-hmm.
Their governor came out and said, like, we specifically did not test people that died in their house, so those numbers aren't in our death count at all. So there is the possibility that could be skewed in either direction.
Mm-hmm.
As far as like deaths are concerned. But,
so we need better information, right? That's what it really comes down to. People need to be able to make their own decisions, and they need good information to do that. And we don't have the ability to do either of those things. We don't have the good information, and we're not allowed to make our own decisions, right? Like this isn't a free society. This isn't how America is supposed to operate. When did the government get the freedom to take away people's freedom of assembly? Like, when did that happen? I don't think that was supposed to happen. Like, I don't know. It just feels weird.
I've had conversations with people about that.
Look at this.
What's that?
Right here it says, okay, check this out. This is a fact. I'm sending you this too. 48 million people a year, okay, get sick from foodborne illness, aka food poisoning.
Yeah.
In the United States, 128,000 people are hospitalized. 3,000 people per month die from food poisoning. Does that mean we're going to stop going out to eat because you have a chance of getting sick? There's 420,000 confirmed on average deaths per year worldwide of foodborne illnesses. I mean, it's just.
Yeah. See, but the problem with that is it's not necessarily about the number of deaths. It's about the impact that it was supposed to or could have had on the healthcare and like the hospitals, basically.
So let's talk about that, right? The impact it's actually had on the hospitals has been they told them to not do any of their elective surgeries,
right?
And now they're furloughing nurses, right? There's
big time.
Yeah, so the whole system is wrecked right now.
Which that's another thing that I think that we screwed up on. Like So I know that they're trying to play it safe, and it's also not just the hospitals; it's also us as a society. Like me included, I had talked to the VA about going to the hospital to get a couple of different tests done. And it's very difficult and time consuming to get anything done through the VA. So I had these appointments scheduled months in advance. And then it came time to do it in like March, and they called me and they were like, "Hey, Mr. Hollifield, are you still going to come to this appointment?" And I was like, I think I'm going to play it safe and just cancel that. So that, they stopped taking certain types of patients, but also people stopped going to the emergency room unless they really had an emergency, and all this different stuff happened. But as far as like cutting out all elective surgeries and all that kind of stuff, we didn't really need to do that. Like, you take specific like protective measures to keep the ICU COVID patients separate from everybody else, and figure out a way to still like do your job and still like give people medical treatment that need it. So that's,
which, by the way, the hospitals were already doing, right? When people come in with stuff they think that they can spread to other people.
Oh yeah, of course. Yeah.
They don't just have them sit there and sit in the waiting room spreading their disease everywhere. Yeah. Like, the hospitals are already doing that. It's like, anyway.
Yeah. So that was, that was a major fail. And I don't know what level that goes to, like who's to blame for that, but deciding that we were going to completely cut out elective, like, whoever made that decision should have been able to see that if that was going to last for any extended period of time at all, that was going to cripple like the healthcare industry, or at least the hospital systems and stuff like that. Like, people are going to lose their jobs from that. Hospitals are going to lose income. Like, that's ridiculous.
Yeah. It's a disaster.
Honestly. And the hospitals here are laying off, not furloughing. They're actually laying off. I mean,
yeah, it's nuts. I mean, my brother-in-law is about to get a surgery, I think tomorrow, that he's been waiting on for like months now. New York, I guess this hospital doesn't have any COVID patients. So they're like, I don't know, did something so that they don't have to deal with that and they can open back up and have elective surgeries. But yeah, it's messed up. I don't know. Hospitals are wrecked. Even the hospitals are wrecked. So that's the thing. If the whole issue is to not overrun the hospitals, and now hospitals are empty and firing people, what are we all doing at home?
Why can't we open? Exactly.
Right. Like it's not logical at all. So, I get in certain hot spots in New York, right, and other places, but that's a local issue that should be dealt with locally. Like, and if they need help from the state or the feds, then I don't. It's, to me, it's kind of Fauci's whole like, we have to shut down as a nation and do it all together. I think it was kind of like a little weird. I don't know. I don't think that we really needed to do that, but I mean, I'm not a scientist.
A lot weird.
I don't know. Yeah. And also Trump, like, actually listening to him and doing it was also kind of weird. Like, I was surprised. Trump's economy was doing great by a bunch of metrics, right? I disagree with a lot of those metrics, but it was doing great by a lot of metrics. And like, he shut it down himself, basically, which is pretty amazing, actually. It's like not something I would have expected him to do.
I think it was so much of the fear of the unknown, because, if you don't and think this thing really is like Godzilla and 10 million people die, then the blood's on your hands forever. I mean, you're stuck between a rock and a hard place. I don't care who's president, you, me, Trump, Obama, Biden, whoever.
Yeah.
I mean, it's a spot where the fear of the unknown, when you're dealing with lives. I mean,
the other thing I was going to say about the H1N1 comparison you made, Rob, was 2009, Obama's first year of his presidency, right? And we were like still in the shitter in recession. So like there was no more economy to wreck really at that point. It was kind of like it had already been wrecked. And right. I mean, really, like it wasn't nearly what it is now though. If you look at the unemployment like by week or something like that, the numbers from 2008, 2009 don't even come close to what's happening now.
It was like a total of like 10%.
Like a huge spike.
It was like a 10% unemployment rate for the entire, like the economic recession from 07 to 09. It was like 10% total at the highest. And now only like a couple months into this, we're sitting at like 15% already. So we're already higher than 2008. And I think the Great Depression over a 4-year span, the highest that they got was 24%. And they're thinking that we're going to end up around there. And then we should have like a very quick rebound. But
do you know what the numbers are where that 15% comes from? Like the numerator and denominator of that?
The one that I looked at earlier was, I think it was just based off of the people that are claiming unemployment. It was a Department of Labor statistic.
Okay,
That I saw.
I'll have to look it up.
Yeah, 40
I
million.
calculate like
They went off of
20 million over.
they went off the number of 40 million, not 21 million.
Okay, yeah, so that makes more sense. But yeah, I calculated 13% earlier. The 21 million over labor force currently or before COVID was like 165 million.
Mm-hmm.
So, but the bigger issue really with our economy was the labor force participation rate was so low, right? Like that's the whole issue with the way they measure the economy and say it's doing well versus like how it's actually doing on Main Street, right? Like the people that stop looking for a job that get dropped out of the labor force mysteriously instead of counted as unemployed. It's like, okay. Yeah. So anyway, it's kind of a mess.
I had a few employees, honestly, I would never mention names, but I had a few employees that were more entry-level positions flat out asked me, hey, if you're cool with it, I'm fine. Why don't you just go ahead and furlough or fire, lay me off because I'm going to make more money on unemployment. And that, I don't know. I don't want to go on a rant right now, but I mean,
right? Like, is that good for them? Is that good for you?
But
it's not good
in
for
their
anyone.
mind,
they don't have a job
like,
now. Like,
I can sit at home. I can play video games. I can play on the computer, whatever I'm doing. And I can just log up my account, or I call it mailbox money, and do nothing. Or I can work for a company with a chance to help the economy, contribute, participate, and grow and create a career. But I'm nominating myself to be furloughed. I'm nominating myself to be laid off because I can make $150 more a week than I would if I were to work.
Yeah. Well, I mean, there's something to be said for if the government's handing out money, you should take it because it's your money that they're handing out. So you might as well take some of it back. But yeah, I don't know.
Right now, that's just money they're printing.
Unreal. Yeah. Well, yeah, it's your kids and your grandkids' money they're giving out right now. That's
exactly
the fucked up thing. Yeah. It's a disaster, man. I don't know how it ends. So yeah, that's why I have a little bit of Bitcoin. Nice. Yeah, it's I don't know. The financial system's messed up. I was at the end of my high school, right? At the last crash, like 08, 09 time, I was like coming into adulthood. And so I was like just curious of what the hell was going on, right? Like why is all this happening? And I started looking into all of it and like nothing is fixed. Nothing that was like happening then is fixed now. Like the economy is still like in just pretty much as bad of shape as it was. Like when that crash happened, before it happened, like, I don't know, people can't afford their homes still. People are, like still in tons of debt. Government's still in tons of debt, way more now after COVID. Like, I don't know. None of the issues have been fixed. It still feels like we're like headed off like a cliff or something economically. Like I don't see the light at the end of the tunnel yet.
Yeah.
It's like kind of messed up. Like, I don't know. People say you shouldn't worry about the national debt, like modern monetary theory. Do you guys know anything about that?
I've heard people say that.
Oh yeah.
So that's like the whole progressive like view of economics now, right? It's like the logical conclusion of Keynesian economics. Like money doesn't mean anything. You can just print it. And as long as we can print our own money and pay our own debts, then it's fine. As long as our debt is denominated in our own currency and we can print it, we should just print it and pay it and rack up more debt. And the wheel keeps going, right? It's just numbers on a paper. Doesn't matter. The Fed's balance sheet could go to the moon and we're all fine, right?
Yeah.
I don't buy that. Like money hasn't functioned that way historically. I don't know. I'm just not sold on that theory yet. But they're definitely experimenting with it now. Like they're printing way more money than has ever been fucked with before. Like way faster. Like a lot faster. Statistically significant. Like whatever the like further down the line. I don't know. We'll see what happens, but I definitely recommend some hedges against the dollar. Like whole fortune, but like, have some gold. And I don't know if Bitcoin's good or not, but I think it's worth a shot.
Yeah, I mean, there's been some pretty good movement in it. I turned on my alerts on Coinbase.
Yeah.
like a month.
So if you look at, so Bitcoin was created right after the last financial crisis, right? If you look at the chart of Bitcoin versus the dollar, Bitcoin goes up, right? It's like exponential growth. If you flip that chart and look at the dollar in terms of Bitcoin, it's the dollar going off a cliff, right?
Yeah.
So there's two things that contribute to that. It's like the actual appreciation of the value of Bitcoin and the actual depreciation of the value of the dollar. That's it. Those are the only two things.
I remember seeing a bunch of people
to that, right?
A bunch of people were like, it doesn't have any value. Like, I guess people think that the dollar is backed by gold or something. I don't know, but people were like,
what does the dollar have? Yeah.
Bitcoin doesn't. It's not worth anything. It's just a fake currency on the internet. I'm like, the dollar is just a piece of paper. Like realistically, it's worth whatever we decide that it's worth at the end of the day.
The dollar is actually a loan. Did you know that? The dollar is actually a note, like a credit note from the Fed. Like it's like a loan to you from them that you can redeem for like goods and services. It's like not, it doesn't have intrinsic value. Like there is no, So, I mean, it's backed by the United States, right? Its citizens and its government and its economy. But I don't know. We're not very good stewards of our financial future right now. So I don't know what that means. Luckily, we're better than a lot of the world, right? I mean, that's really what keeps it going, right? All the currencies go against each other. Bitcoin's no different. It's really just like the dollar or the euro or anything else. They're all battling each other. They're all kind of don't have much intrinsic value. It's just like what you can get with it. That's kind of the way it all works now. Even gold, people say like, what do I need gold for? You know, it's not actually that useful for me. Like Warren Buffett, people like that, they say gold, Bitcoin, it's useless, right? Like, so I don't know. It's interesting. Like macro wise, I have no idea what it's going to mean, what COVID's going to mean, but it's certainly accelerating. If there was a problem before with the debt or you know, the way we're managing our finances or our budget or whatever, that problem is way exacerbated now. Right? Like,
it's like throwing
not
gas
everyone
on a
agrees
fire.
that there was a problem before, but it's like, so
it seems like the debt really is like not like nobody thinks about it, nobody cares about it. It's not really. It's just something that's there. It's like it's almost like student. It's almost like student loan debt. Like
but like the average Joe doesn't care because they're like, oh, you know, it's the federal government's balance sheet. I don't have to pay it. It's not my problem, but it is your problem. It affects all of us.
Well, so what ultimately I think happens from that is the US dollar stops being the world reserve currency, right? At some point, the world nations will be like, the dollar is not any better than this or that, right? They'll decide something else, especially if it's a group of countries. So some countries are already working on that, like the BRICS countries, Brazil, Russia, India, China, South Africa. They're like creating a basket of currencies or something like that. That's like supposed to rival the euro or the dollar. Not like a global currency, but like something that's supposed to rival like the euro.
Note. I want to look.
I don't know what the currency is called, but I think BRICS is the acronym. BRICS. It's like, I think they're like, this is not new news. This is like maybe a year or two ago, but they're like, you know, coming together as a unit, basically, like trying to rival like the European nations or, you know, the US, whatever, the Western Hemisphere nations. I don't know what all the groupings are, but they're like trying to form their own, you know, economic group, basically. It's like up and coming nations. And so if like a group of nations like that, right, or if like the EU and the BRICS countries got together and decided that the US shouldn't be the world reserve currency anymore, that would like be really bad for Americans. Like right now, and OPEC prices oil in dollars right now, right? So when Europe buys oil with euros, they have to buy dollars first. Like they have to translate their euros to dollars and then buy oil with dollars. If OPEC stops doing that, people don't have to buy as many dollars. The demand for dollars goes down and the value of the dollar goes down. So like right now we have goods and services really cheap here and people don't know it. Like gas is not expensive at $3 a gallon. gas is cheap at $3 a gallon globally. It's like super cheap.
Yeah,
We just don't
it's that
realize
per
that.
liter in Europe.
Right. So
$4 a
people
liter.
don't realize that. But that all changes if the dollar stops being so widely used around the world, right? The demand for dollars goes
Never
down
thought of
and
it that way, but that's interesting.
prices in dollars go up, right? Anything we
Yep.
buy from outside of the US with dollars and have to translate to their currency, right? If the value of the dollar goes down compared to other currencies in the world, it's bad for us. And that hasn't happened yet because people still say the dollar's good, right? They're still following us off this cliff, right? But at some point, if they're like, hey, the US isn't doing so hot. They got a lot of debt. You know, they're not really good shepherds of the world economy. It could happen, right? It would take a group of powerful countries to make it happen. But it could. And that would be
and
ugly
also like a
for
really
us.
good stable alternative of money.
Right. People would have to have somewhere else to put their stuff other than in the US dollar or US companies, right? That's what keeps it happening right now. That's what keeps it rolling. People still have places to put their money in the US and still trust it.
Mm-hmm.
So we'll see. I mean, China's definitely trying to take some reins, but I don't know.
Well, I think China shot themselves in the foot here with this.
Yeah.
Their shitty cover up and working together with
Yeah.
the WHO and
yeah,
It's going to get real interesting the next few months. I think a lot will be exposed.
Yeah, it's going to be. I think it's going to be pretty bad for China. They already were doing terrible with the like before all this happened. The Hong Kong riots and protests and all that, human rights violations. What's it? Organ harvesting. Like, I mean, they had all kinds of stuff like sweatshops. But now I think I've seen estimates of something like 50% of the world's deaths could have been prevented if China had just acted sooner and been honest with WHO and with other nations from the get-go and said like, yeah, we have this like scary virus that it transfers from human to human. But they didn't do that. And then the WHO helped them cover it up. And then there was I don't know if you guys are familiar with this, but there was a doctor in China that actually like broke down the genome of the virus and told the government. And
wasn't he killed or died shortly after?
He died from coronavirus. Like,
yeah.
I mean, he could have been killed. Who knows?
I read on
that's
that.
That's a conspiracy.
Yeah.
Like, that's
Nobody knows.
I would buy that pretty quickly if somebody told me that he was murdered and they called
he was being
coronavirus.
silenced by the Chinese government. I wouldn't be surprised if they silenced him for good. Like that wouldn't be that surprising.
Well, what happened is like
any of the Clintons over there. Sorry.
I think the Clinton Foundation is probably tied to the Wuhan lab, actually, but no, there's like I think it's through the World Health Organization, an agreement that like if any like doctor or institution or country comes into contact with something and they figure it out and they know that it's a threat for like human to human transfer of a virus like this, they have like 24 hours to report it. So this doctor figured it out, reported it to China, and I think it was like, I'm gonna have to fact check myself here, and I'll fix it on the video if I'm wrong, but it was like they ignored him, and then I think like 6 weeks later, or it might have been, it was either 6 days or 6 weeks later, but regardless, they hadn't come out with it yet, so he published it himself, and they shut down this guy's lab and silenced him, and then like a short time after that, he died from coronavirus. So, it'd be really interesting to see what happens to China after this.
It's interesting because if we really think that it was already here, then it wasn't necessarily their responsibility, right? We like to put it on them, but if it was actually already spreading, like, I don't know if it actually started in Wuhan or if Wuhan was just the place where it like really blew up for the first time. I don't know. It would make sense that it started there and it traveled outwards, but that even so, like it was traveling out of there for months before anybody knew.
Mm-hmm. Well, that's where all the data points to Wuhan as being the center of it all.
Yeah.
And they're talking about like early December that China knew, I think.
Right. The first cases they say in Wuhan were like early on, right? It was like,
Yeah.
end of
So
November, early
if
December.
they knew, because they didn't tell us until February, like 2 months later. So
No, it's funny.
No. It
say
was
that
way earlier than that, right?
because
late
Dave,
January.
you know, my dad has
Late
a
January, yeah.
medical supply company, and they import medical equipment from Europe and China. And the company he works for, or the company he works with, importing their product to the U.S. market. In December, they were telling him like how bad it was over there, what was going on. January,
Really?
how sick they were. Can we go ahead and send y'all masks to have all this? And like we're sitting here like, dude, what are they talking about? Like they're crazy. And like literally, I mean, he has the WeChat conversations with the date showing where they're like, dude, you know, thousands of people are dying. This is going on. It's like, I'm turning the news on nothing. It's like, he's asked me, do you think there's any validity to this? What's going on? I'm like, I don't see anything here. I mean, do you think United States, if anybody would know? So, I mean, they covered it up. I mean, I think it was definitely before December, November, October.
So China wanted it to not be just in China when they announced that they knew what it was, right? They didn't want it to be official that they covered it up, right? It's like, oh, we just discovered it first, right? We were the first ones to like identify it, but we weren't necessarily where it started, right? That's kind of what they wanted, it seems like.
I mean, I haven't heard that argument. I mean, they've pretty much always said that it originated there in Wuhan.
Did they?
Yeah, because they were like, because at first they said they reported it to the World Health Organization.
Well, who's they? Who's they? I thought the Chinese government didn't admit that. Did they?
I think so. Because they were the World Health Organization was tracking a new virus in December, from Wuhan, but they tried to. The cover up was that it wasn't a human to human transfer.
Ah, okay. Gotcha.
And so they were trying to act like it wasn't contagious.
Gotcha.
And,
okay. Yeah.
And then it didn't come out until like late January.
That they definitely did. Yeah.
Yeah.
For sure.
And then there's video, and then you've got news videos of China, like entire streets shut down with like like full hazmat suits spraying like sanitizer over entire streets and buildings and stuff like that. And they're like, oh yeah. Just last week, we didn't think it was human to human. Like that's completely.
Yeah, they had massive speakers on the street corners, right, telling everyone to stay inside and stuff like that. Yeah, that was like actual quarantine in Wuhan, right? Once they like actually fucking told people to lock the fuck down. Yeah, but
yeah, that was sketchy too. It was like because at that point, the United States, it was still like, oh, it was just like the flu, or it's like it's not really that bad. Like we don't know yet, whatever. But then you see clips of China literally spraying entire blocks of city streets with disinfectant and people walking around in hazmat suits. You're like, that's not a flu response. Like,
seems pretty bad. Yeah,
definitely like there's something to this.
Jeez. Yeah, my sister was saying the same thing when they first like videos came out of them building the hospital like overnight. You know, it was like they're like erecting a hospital in like 2 days.
Yeah,
in Wuhan, like we were like, something's off here. You don't do that for something that's not that big of a deal. And that was like still in February, right? Or like or way early on. Yeah. So I don't know. It's been what about the political compass? I took it, but where are you guys' political compass at?
Mine is so I think it's 10 squares in either direction. I think I'm like a -7 and then to the right, like 2 or 3. So libertarian right.
More libertarian than me, but a little more right.
Yeah, further to the right.
Yeah.
And then Rob was almost dead center left. Like just barely to the left of dead center of the entire graph.
Dead center of the whole thing? Wow.
Almost, yeah, it's pretty close. I've never seen that before.
That's amazing. I feel like a lot of America is in that like center circle.
But right? Dude, I've got You'll have to I'll have to find all the ones that people have sent me so far. But actually a lot of people kind of close to you, Brian, like low left. And then I've had maybe like 1 or 2 that are like high right. And that's where like most presidents are. Like even Democrat presidents are actually to the right and authoritarian. And I don't know if y'all read like the breakdown of how that works.
I didn't go into that.
So no, I haven't either.
Yeah, so everybody talks about a political spectrum, like are you left wing or right wing or whatever. It's actually like a lot more detailed than that. So left to right is economically, and that's are you like to the like further to the right is capitalism, and then like hard left is like socialism.
Like socialism. Yeah.
Yeah, and then to the top is authoritarian. So that's like, do you want the government to control you, like fascist stuff like that? And then further to the bottom, the closer to the bottom you get, is basically like the less amount of government control.
It's like anarchy. Yeah.
Yeah, anarchy, libertarian. At the very bottom is anarchy.
Very bottom is anarchy.
Yeah,
right? Yeah.
Somewhere towards the middle of the bottom is like libertarianish. But yeah, most like politicians, most modern politicians are like to the right, either like 2 or 3 and up like 2 or 3.
Interesting.
But like I think Trump is pretty like high up on the authoritarian though. He's almost to like the top right corner, not like top right corner.
Yeah,
but
yeah.
He's up there.
I mean, that would make sense. You know, he wishes he could be a dictator, right? He said he had full authority over the governors, right?
Yeah,
It's like okay, man.
Yeah, I don't know. I think everybody kind of knows I'm not like a biggest fan of Trump, and I was a Republican my whole life. I grew up pretty conservative, but there's a lot of stuff.
I definitely grew up conservative. My dad's conservative for sure.
It's kind of funny though. I was expecting you to be more liberal, I guess. Like you've kind of you've said a lot of things in this conversation.
Absolutely.
That I completely that I've heard from a lot of conservatives.
I agree with that. Yeah, I liked.
Well, so I mean, I try to listen to both sides. And,
that's how I am.
And honestly, I think a lot of the leftist stuff about this has just been fear-mongering bullshit. Like, I'm sorry, but that's been a lot of what I've seen, and a lot of what's been on the right has been a lot of like, don't worry bullshit at the beginning, right? And then it was like, oh, now that Trump's doing something about it, we're gonna make it like it's a big deal, and we're handling it properly, right? Now it's a serious issue, and we're glad it's being handled,
right?
But like before, it was not an issue at all.
It was right? Like, this is bullshit. Like, don't worry about it.
Yeah, and so I don't know. I just see both sides of it, I guess, and I think both sides are doing a lot of bullshitting. And it's like a lot of cover your ass, right? A lot of cover your ass press conferences and stuff.
Absolutely.
I don't see a lot of actual data, a lot of actual good decision making based on information. And I don't know. It just seems weird to me that you tell people to lock down before you tell them to wear a mask, or on the same day. Like, we knew about a respiratory virus traveling for a long time. We could have had a mask order in the same time we had a travel ban from China at the end of January, right? Like, it wasn't a logical response. And I think that really, really wrecked the economy, right? The logical response would have been, if you're young and healthy, take precautions, but continue about your life. Tech companies, if people can work from home, let them work from home, right? This would have been a logical response to like actually take proper steps to like have people stay home, right? If you can, don't eat out as much. Not don't eat out all the time. Not like let's give the restaurant a death sentence, but like tell people to like, go out a few less times a week. Or tell restaurants to like, reduce the number of tables. Like, this would have been a logical response at first to actually see how bad it is, right? But instead it was like, before we knew how bad it was, we just went, cut everything.
Yeah,
they didn't gauge the temperature real well.
Yeah, there was something that like I always thought it was super arbitrary that they were like, no meetings of more than like 10 people, or no like hanging out with more than 10 people or something like that. I was like, why did they pick 10 people? Like,
exactly.
Right.
Anybody could be sick within that group of 10 people. Like I could understand if you said like, you made it some reasonable amount that would prevent a bar from being packed out,
Right. So this is you're hitting the nail on the head, right? It went from 50,000 people in NBA stadiums to no more than 10 people. Okay. Crazy. That's ridiculous. Like that, like That's ridiculous. They could
But
have
like
said,
you said, where did that number
Coachella.
come from?
Yeah.
I feel like someone
totally
literally
arbitrary.
was just like,
10 sounds, yeah, they're like 10 sounds
Yeah.
reasonable.
Well, they figured if you told people you couldn't see more, I mean, shit, a family could be 10. Like you could have more than 11 people in a household. So it's like, they can't really tell you can't be with your family, can they?
Yeah.
So like, that was probably like, 95% of homes are less than 10. So we can choose, statistically, we can choose that number and be okay or something like, that it probably wasn't arbitrary. It was probably like, we can actually safely assume that most houses are under 10. So, that's
so
the
people
number.
don't have to move out of their house.
Right. Yeah. Like, so people don't have to quarantine from their kids. Like, I don't know. It's some Mormon families definitely have more than 10 in their home. I can tell you that. So, I don't know. It's really, it was totally messed up, that response. Like, and I don't know how it could have been better, except just like taking smarter measures earlier, smarter measures earlier, right? Like wear masks, tell airlines to start like super sanitizing the planes, like, right? Like they could have done this sort of stuff, but
have you kept up with Georgia at all?
What do you mean?
Like, have you paid attention
to the coronavirus stuff?
Well, yeah, with Governor Kemp.
No, I've seen some of it. I saw like a lot of people shitting on Georgia for opening back up. Like I saw a lot of liberal media about that.
But it's how we opened was the most. We look like the asshat of America.
Yeah, kind of.
He was just like, yeah, let's open up like the places that are first off,
the tattoo parlors.
No one goes to.
Yeah, it's impossible for them to follow CDC guidelines. Let's open those up first.
Yeah, well, let's. I think he said literally. I thought like he read the wrong list. Let's open the most non-essential of non-essential places first.
Right.
Yeah.
Like when he said
Even
it,
Trump shit on him, right?
I'm like, dude, I think whoever gave him the list to read or his teleprompter, he wrote the wrong list. Like, it was comical.
And that was after he already came out.
As a dentist, unless like I come in. We had to submit everything for insurance. Like we're being audited right now. If a patient comes in and let's say they're outside playing, they fall on the curb and bust a tooth out. Yeah, we can do a composite, build up and fix it. But they're like, man, I want to go ahead and pull the tooth and put an implant in. We weren't allowed to do it. But I can go get a tattoo.
Yeah,
wow.
That's ridiculous. Yeah.
So the same state order allowed the tattoos and not the dental work?
Oh, yeah. Like if my grandmother had a denture and it fell out and broke, I couldn't take her in to get it fixed because that's considered an elective.
Yeah. And this was after he had already come out and said like, oh, I didn't know that you could pass it asymptomatically, right?
Yeah.
Well, Kemp shouldn't even be governor, right?
Yeah, but he also encouraged people to go to the beaches and get out and practice social distancing and go to the beaches on a Sunday. And then on a Tuesday, he's having a speech on TV, shutting the beaches down, wanting to know why everyone's using Airbnb to come to our beaches. It's like, dude, you're telling people to do one thing, then they do it. And then you want to slap them on the wrist for it.
Yeah. He's flip-flopping like crazy, man. Even like,
it's unreal.
Like we just extended our state of emergency for Georgia until July, right?
Yep.
So it's like, I don't know. He just can't make up his mind. Is it bad or is it good? Like he's like, we're going to wait really long to shut down Georgia. And then we're going to reopen it back up like in 2 weeks.
Super fast. Yeah.
So then we're going to act like, yeah, it's actually not that bad. Our numbers look good, but actually it is bad. So let's extend it to July. Like
that's going to keep happening all fall and all winter and into next spring, right? It's like, unless we have a logical response, then like that shit's going to keep happening.
Well, the CDC guidelines for reopening schools and stuff like that, it's looking like, unless there's like a dramatic decrease by the time schools open back up in like August, September, they're not going to be able to do the social distancing guidelines for schools, which means that they're going to still have to do distance learning, because it's like, I mean, it's the same guidelines that everybody else has.
That works.
Yeah.
Right. Kids in front of a screen learning from their teacher. That works for an extended period of time.
It's funny you say that. my buddy's here visiting from Kansas City. He's chief operating officer of my company. And he's going back to school for his doctorate. And they got a email today saying they would resume in-person class for testing starting in July. And that's in Kansas City, Missouri.
Huh.
Interesting.
I've seen, I met some folks
Kansas
from
City?
Cincinnati. They're out at the bars and stuff.
Dude, he's got videos. He can show me their casino is right on the Kansas City, Missouri border, right where the river is. The casino there had a 3.5-hour wait to get in. I'll send you the video. It looked like the mazes we would draw a board on our paper. You know, you do like a square within a square within a square. That was the line around the casino, people wanting to gamble.
Damn.
So this is the problem that's going to happen, right? If the government keeps doing what they're doing, they're going to open businesses back up at 25% capacity, but they're going to have 75% demand, right?
Oh,
so you're going to have a line
absolutely.
out the door of people that want to come into your restaurant and you can't pay the staff and you can't allow them
speaking of
inside.
that, did you see here now they're starting at restaurants like the steakhouses and stuff, they're adding a PPE fee to your bill. It's an extra 8%.
No, that's the first I've heard of that.
Yeah, so like they're adding on there, like it's crazy for protective, but it's a PPE fee. And now in our dental offices, when we submit to a dentist for treatment, like you bill insurance for like a crown or a denture, we can also have a line code. We can bill for PPE, and insurance will reimburse us an extra $100 per patient because of the N95 mask. We're getting the face shields, the UV lights, the air. I mean, because dentistry, there's nothing more. You're in someone's mouth.
Yeah.
So on average, we're putting $30,000 in PPE equipment in an office before we even reopen per office.
Wow.
We had to get chair-side aerosol suction units that sit right here. So, no longer the little straw everyone likes. You got an actual mask over you. It's crazy, man.
Damn.
Yeah, it's never going to be the same. I like flying. I think that this is just going to change the way a lot of things function.
They said we could resume international flights to certain places. And I saw like end of June and 1st of July.
Yeah, I think we'll just see a lot more hand sanitizer places.
Well, I think we're going to see a lot more remote working too.
I identified that one pretty early on. Like,
same here.
I've always thought that should happen more, right? I worked at Apple for 4 years, and it really frustrated me that I had to commute like 3.5 hours a day just to be in the office where I could like text message and type to people that were like 10 or 20 feet away from me. Right. Like I would commute and then be like typing messages to people that I can shout to. And it's like, it doesn't make sense. Right. And so I identified pretty quickly that when this happened, as soon as people's management starts realizing that 80% of their workforce can work from home and still get their job done, they're going to realize that they don't need 100% of their facilities, and it doesn't make sense. Like at big companies, I don't know if you guys have worked at any big companies, but they have like huge offices, right? You got a ton of like big, a whole floor of an office building or 4 floors of an office building, right? You don't need all that space. If a bunch of people can work from home, you can have 1 floor and you can have touchdown offices where people just come in when they're in that day, they stay at that desk, right? You don't have to have like set offices.
That's why I think like those places like will become so popular. Have you looked into those?
Like co-working spaces?
You can basically you can rent a conference room for a day. You can rent an office for a day, rent office for a week, for a month. So a lot of traveling executives, we rent them for meetings, but at the same time too, I mean, just keep them clean and sanitary. But if I got if I'm a director of sales and I've got 10 guys doing sales under me, instead of having brick and mortar to go to every day, we can do what we're doing now and meet once a month at a WeWork for $100 for a meeting table.
Absolutely. And so like the big companies, right? It's not only that, it's all the money that goes into having employees in the office, right? Having a facility where they can eat lunch, having like ergonomic, like your desk at the right level. Like, oh, is your setting proper for your desk? And like, oh, this team outgrew this building. So we're going to move this entire team to this other building, and we're going to move this smaller team into this building. And when we do that, we have to reset all the desks. We got to ship everybody's stuff over to that building, right? Like you're literally paying for all of this stuff just to have people in these seats instead of at their own seats.
For a business, guess workers' comp goes down big time.
Yep. It's going to be the freelance economy is going to go way up, and benefits are going to go way down.
Absolutely.
And yeah, that's
the
what's happening. Right?
The 1099 subcontractor will dominate.
This is accelerating what was already happening, right? The gig economy that
Yep.
we were going into. So that's what I was saying earlier. Like, I think people should just take the bull by the horns, man. That's where it's going. If you work in a place where you can do if you're a chiropractor and you work in a chiropractor office, like, you could just have your own table and travel and go, visit your patients. Like, I think it's gonna go that way. I think people should think more about that, honestly. It's just doable. It's not that hard. You can build a website on Squarespace in a day. Like, it's really not that difficult. People don't realize, right? But I mean, David, I'm sure you figured it out going into the podcasting. Like, the technology is kind of difficult, but you can figure it out, right?
Yeah, it's all there. I mean,
how to
it's
make
like,
it all work. Yeah.
Yeah, I mean, there's already platforms set up for it that you don't have to figure it out yourself that bad. You can just Google it and spend a little bit of time trying to figure it out, and it's all there for you.
Same with a website. Like, you don't even have to build it. You can just go on Upwork and say, I need a website.
I have a GoDaddy website right now. I've got I'm on Podbean.
Teledentistry for us is booming. I mean, and for regular MD doctors too. I mean, if you're at home, you can talk to a doctor. I mean, I have Humana insurance, and they're pushing that on you. If you wake up with a fever, they'll schedule a tele meeting with your doctor within 30 minutes. You sit there, take your temperature, show them, give for minor stuff, amoxicillin, whatever you may need. Obviously they're not writing opioids and stuff like that over the thing. But I mean, we see it in dentistry all the time now. The patient comes in, gets their teeth cleaned and x-rayed. They never see the doctor. They go home. The doctor reviews their charts, looks at the x-rays. Hey, by the way, buddy, you got a cavity on tooth number 13. Let's get you back in and get a crown on it next week. We're pushing it every day, and it's working great.
Yeah. I mean, Zoom is huge right now, right? It's like certain businesses are taking off. Yeah. It's just really amazing how that all works.
I was listening to a podcast before we got on here. I'm going to do another episode that's like centered on like mental health and like suicide and
sure.
drug abuse and stuff like that. That side of
this economy is definitely contributing to that. Like,
exactly.
This is definitely going to contribute to that. It is another topic though. It's definitely
I mean, that deserves like a full entire episode to itself. But but they were talking about like the stock market and the economy as like two separate entities, because a lot of people think of like the stock market as like the economy for America or whatever. And a lot of times, like with the Great Depression and like the Great Recession of 2008, whatever, like, the stock market crashed, so the economy crashed with it. But right now what we've seen is like the stock market dropped like drastically, and it's already rebounded like a lot. And
Bitcoin's already back to where it was before. So like, COVID.
Absolutely.
Yeah.
Google,
it's where it was when it crashed the night, like March 11th. I was telling you when it crashed, like it cut in half that night. Bitcoin was down like 40% or some shit. It was ridiculous, but it's back. It's back to where it was. Like, the stock market's doing the same. It's like bouncing back.
Well, they were saying that like 20 or 25% of the S&P 500 is held up by like Google, Apple, Microsoft, basically like tech companies and Amazon, companies that are actually like not having real trouble during this downturn. Like Amazon is thriving right now.
Yeah, they're booming.
Zoom is also booming right now. So
what's funny about that is Amazon factory, or their distribution warehouses, right? Theoretically, those people should not be like in there. That's a hotbed for COVID, right?
Yeah.
Like, oh my God.
But they're not on the news as all getting sick. I don't get it. They're there. Thousands of them are working, and you're not hearing, this Amazon plant has 10 breakouts, has 100 breakouts. Where's that at?
I don't know. But it's the stock market's totally disconnected from the economy, right? It's totally disconnected. It's all speculative. It's the same as Bitcoin, essentially. It's like,
that's what they got to. They were like, it's people bidding on companies to react a certain way to be able to survive, whatever. So it's like, It's kind of different though than any other recession or depression that we've seen in
But
history.
we're seeing right now a lot in dental and other small companies, because I have equity in other companies as well that are non-dental related. What's happening is a lot of these small mom and pop businesses in areas that were thriving prior to this and are having to close. You're seeing private equity firms come in and buy them in like industries and consolidate. Private equity scooping up everything they can right now for 30 cents on the dollar.
Yeah.
So
these big economic events like separate the rich and the poor more and more and more.
yeah.
And
That's
more,
what I
right?
was going to
Every
say.
time this
the
happens,
rich are about to
it's like
get richer. It's a buying.
not about to. They've already done it.
Yeah.
They got richer between February and now. Like
Yeah.
they've already like, you know, they're shorting stocks as it's falling.
Oh yeah.
Right? It's happening. It's already happened. You know, that's what, in my mind, that's what February was. February wasn't like the lost month. February was the month where the people that knew what was coming were busy talking to their financial advisors and moving their money. Like I mean, realistically, that's what I think was going down. It's like, why else was there nothing from the government between January 30th and
And
March,
all these real estate
whatever.
gurus are about to scoop up all these foreclosures coming. They're about to make a killing. But you got to have money to make money.
Hertz just went out of business, right? They're selling a shit ton of cars for cheap. If anybody out there is looking for a car right now, go on Hertz rent to buy program. Like they're selling a whole fleet of cars right now. Yeah, I mean,
and the another thing is like the housing market is actually set up a lot better this time around than it was in 2008, because the debt to GDP ratio is like people have a lot less debt now than they did going into the 2008 recession. And there's
Do you have those numbers? What is the debt to GDP ratio right now? Do you have it handy?
It was like 60 to 65% now, and it was 85% in 2008.
Wow.
So it's like 15 to 20%.
That is substantially larger.
60 to 65% debt to GDP.
I don't think that's accurate anymore, is it?
This was from like a month or two ago, but this was going into this like the recession.
I think we're like over 100%, aren't we?
But they were talking about starting. They were talking about going into 2008 when the recession hit versus going into this. We were at a lower, So and also like there's still a massive need for new building and stuff like that. So we're gonna basically, they were just saying like we have a very, very strong chance of like recovering fast. Like this hit us really fast. Unemployment went super fast. The stock market fell fast. The stock market has already recovered. They're thinking that unemployment is going to recover pretty quickly, and that like, you know, the housing market is going to recover pretty quickly. Really the housing market hasn't crashed yet.
I don't know to play advocate to that. A lot of people I know, and we work with a lot of large companies, they've learned how to adapt and work with less and people at home. And I think a lot of CEOs and CFOs have taken note, and they're getting ready to trim fat, buddy. They're going from a ribeye to a filet.
They're not getting ready. They've been doing it.
I'm telling you. I was trying to say, like, we work with one really large DSO, dental service organization. I mean, they do $3 billion a year in revenue, and they cut 48% of their middle management, and they plan on bringing back less than 10% of that because they said they've learned they don't need it.
This is a catalyst for them to say.
People aren't thinking that, but that people have learned literally how to lean up, and
it is.
They're getting to work on 2 cylinders. They don't need 6.
So the job numbers of 41 million people that have lost their job or whatever. Most people are not like you, Rob. Most people are not taking PPP and keeping all their people. Most people are saying, sorry, we're not going to be open for the next 3 months. I got to let you go. Right. That's just what's happening. And I think a lot of those restaurants aren't going to reopen. A lot of these places, nail salons, and it's like they don't have 3 months of runway. Like it's just they just don't. You know, it's not. You know, what is it, like half of America doesn't have $500 for a emergency expense or something like that. Like I don't know what the exact number is on that, but it's, you know, it's a ton of people that put their livelihoods into their nail salon, right? And then they're operating at like barely any margin for the first 3 years while they're building it, right? And if this happens, like there's nothing you can do.
Yeah. And you said earlier, like, this is, you know, it's a wake up call. And like, you know, hopefully the plus side of that is that, you know, people are smarter about their business in the future. But so I was just going through that thought process in my head, and I was like, okay, but we literally just got out of a recession, and we were doing really good. Like we had an amazing turnaround from 2008 to now, and
Absolutely.
By some metrics,
yeah.
we did for sure. So that I touched on that earlier, right?
But we
Like,
still don't have people still didn't set themselves up to maintain.
Well, right, because the incentives are all fucked up right now. There's no incentive to save money when debt is free, right? When you can go get an auto loan for 0.99%,
84 months at
incentivized.
0%.
Right. You're incentivized to go buy a car with money you don't have.
Yeah.
You're not incentivized to put money in the bank and save up to buy a car you can afford. You're incentivized to go buy a car you can't afford and pay it over 84 months, right? Like, this is the entire economy is functioning on this, right? Apple is taking on new debt to buy back their own stock. Like, debt's so cheap that they're like, our stock is going to appreciate way more than it's going to cost us to pay off this debt over the next 10 years. So we should just buy more of our own stock. Like, this is happening all over the place because our financial system is just set up for that. Banks get free money, right?
You know what happens
they get to loan it out to us at a margin.
When you finance a car over 84 months, you're guaranteed to be upside down. I mean, you're buying a depreciating asset, and you're encouraging someone to take it on for 84 months. It's going to be out of warranty. You're going to have problems with the car that you can't afford to fix. I mean, it's a recipe for long-term disaster.
Right. And that's the way it works now, right? We have to have unbelievable liquidity, right? Fed rates are at 0 right now. Like, we have to have free money or the whole thing is ruined. Like, the whole show stops if we don't have free money. If the Fed came out tomorrow and said, we're going to raise interest rates to 4%, we would be in the biggest depression ever of all time, and there would be nothing that could stop it. Literally, like 4% interest rates for the banks would ruin the global economy. Like, it's a mess. It's a total mess right now. And like, that's the way it all works. If you want to go to school, get a loan. You want to get a car, get a loan. Even now, you want to get a TV, like, buy it on layaway. Even like our products on Chill Systems, we sell a $50, $60 product, like maybe $100 order, right? We have 2 different ways for you to pay over the course of 4 months on our website. Like, we don't offer them. Like, companies reached out to us and said, hey, we can give you a free way to offer 4-month payments on your website. Right. And we're like, okay, sure. We take an afternoon, we integrate their system into our system, and there's a little icon on our website that they can use now if they want to pay over the course of 4 months. That company pays us immediately, and they pay for $100 over 4 months.
Yeah, dude. No, I noticed that on Amazon. I think I don't even know if there's a price limit on it. Like, I've been doing, like, buying all kinds of random, like, fishing crap on Amazon.
It makes sense for expensive stuff, right? But like, man,
I bought like something for like $20 or something like that, and it's like, if you get the Amazon card, you can spread this payment out over however many months.
It's like
$20.
If
what?
People need to spread $20 over 4 months, like, there's a problem. There's a problem with our economy that the unemployment rate doesn't identify. And then inflation is another one that's really messed up, right? Inflation, they say, is not high. Are you kidding me? How long has inflation not been high? Look at the cost of going to college. Look at the cost of buying a home. Look at the cost of, like,
buying a car,
anything,
a gallon of milk,
like anything that you actually use and need is, like, the cost has gone up astronomically, but inflation's at 2%. Like, according to who? According to what numbers is inflation at 2%? Like, the value of, I don't know, you could go to the movies for like $1, like, what, 20 years ago? I don't know what, but there's definitely a shit ton of inflation. They just don't act like there is. Right. So all those metrics where they say unemployment's low, but all these people have dropped out of the labor force, that they don't count. Inflation's low, but we don't count the cost of homes and the cost of education. Okay, well, that's a lot of what people spend their money on, right? So it's hard to really say if the economy is doing better, or like how good the recovery was, the Obama recovery or the Trump bump or boom or whatever. Like, it's really actually difficult to parse that out from the data, because a lot of the data is skewed and has been for a long time.
Well, I guess basically just like the perspective or whatever that I was coming from is that our unemployment rates tanked, well, not tanked, but like in a positive way. We were doing
Yeah.
very well. The unemployment was like 3.4% before the
Yeah.
coronavirus happened. And the economy, or not the economy, but the stock market had rebounded and had been doing really well. So you've got unemployment rates super low, stock market super high, but yet none of these businesses, like small or big, are prepared for any kind of like even
Right.
1 month worth of economic hardship.
Right. A lot of that is policy driven. Honestly, like that's the thing is like I sent you an article a couple weeks ago about Boeing, right? And the same thing, buying back their stocks and then asking for a bailout.
Exactly.
Right. They're incentivized to buy back their stock, to take on loans and buy back their stock. That makes financial sense. Like the CFO is doing a good job by telling their company to buy back stock and take out loans. Like based on the way our financial system is set up and like what you're looking at as that in that position, it's like, yeah, I can just move this money over here and it'll be way
you're
better.
Leveraging debt.
Yeah. It's like, that's ridiculous. It shouldn't work that way. They shouldn't be incentivized to do that. Right. And that goes all the way down to the people buying a car at 0.99%. Right. It's like all, from the individual level, all the way up to the government. I don't know. There's not really a good way out of it right now because really you need to increase interest rates to make it more incentivized people to save. But if you increase interest rates, the market crashes and everything falls apart right now. So I don't know if you noticed that, but like anytime the Fed comes out and makes an announcement about like if they're going to raise rates or if they're going to lower rates, like the economy is like everybody's waiting.
No.
You know, all the traders.
I was watching that really closely.
Yeah.
I think it was the end of 2018. We bought our house, in the very end of 2016. It was like 2018. The Fed was talking about bumping up interest rate, and people were freaking out. They're like, "The bubble's gonna burst. The bubble's gonna burst." But
the bubble's gonna burst, right? What's the bubble? What is the bubble? Like, I think it's honestly
4% interest rate
bubble. It's a debt bubble. It's a U.S. dollar bubble. It's like we don't actually have this money. Isn't actually worth anything. Like that's the bubble, and eventually people are gonna figure it out. Like on a bigger scale, right? But right now it's just people that get it, use it to their advantage, and they make trades on big fluctuations in the market, and they do these. They buy real estate when the market crashes and sell it when it's up, and people that have money use these situations to make it, and people that don't get wrecked by it because they can't go to their nail salon. It's like it's just naive for people, I don't know, in government and outside of it, to think they can make these decisions for people. I don't know. I think it's kind of crazy personally, but I think it should be like guidelines.
You're sounding
not orders.
Sounding like a damn Republican right now.
Well, but it's honestly like I think it's real. It's not realistic. Like it should be guidelines. People should have freedoms. I'm a libertarian. Like I'm definitely more liberal than I was when I was younger because I lived in California for 10 years. But I'm not like totally leftist. I believe in the danger of coronavirus, but I don't believe in how dangerous they're portraying it to be. Like it is dangerous, but I don't buy the liberal spin on how dangerous it is for everyone.
I agree 100%.
Right. And so I don't know. Sometimes I do sound conservative. I mean, I listen to Ben Shapiro sometimes. I also listen to Sam Cedar and, the Young Turks, but I do, like
that's how it should be.
I try to get good information.
Yeah. I have to explain it to people because of like, it usually ends up being me having to explain it to Trump supporters because they're like, if I say anything to a Trump supporter, then they're like, they just lump me in there with the media, I guess. Like they're like,
right.
Oh, well, you just hate everything that Trump does. I'm like, that's not necessarily true. Like I could give you a list of things that I think Trump has done a great job on.
Right.
But it goes.
That's why I like this podcasting. Free thinking people should be able to like have differing opinions and, change their opinion or hear something new and think something new. Right. Like, I don't think you have to identify as left or right. And
and part of the problem is like, I can't blame Trump supporters for feeling that way at the same time because the way that the media goes after him. Like there's plenty of stuff that you should attack Donald Trump for. But if he fucking sneezes the wrong way, like leave him alone. Like it's not.
Yeah, it's like he sneezed over the right shoulder, not the left. It's insane.
So I, to an extent, I understand, like, you know, if they hear a criticism of him, they're just going to be like, oh, well, it's just another person that wants to nitpick every single thing he does. But I feel like personally, I mean, I have my own biases and stuff like that, but I think that I try to have like a logical reason for anything that I would disagree with him on or whatever.
You try to, right? But the idea that you know what the political compass is, most people don't. Right? Most people aren't that savvy that they're like understanding where they stand on the spectrum and where the biases are and reading stuff from both sides and things.
Yeah.
Most people are like, I don't care at all. I don't want to watch any of it. Right. Or
no, I mean, people have their own like media source that they subscribe to. And it's like, you know, the big ones are Fox or CNN, and that's like their sole source of information. And they think that source is unbiased. Like they think that, like, if you're Fox or CNN guy, you think that that's the center. You think that like, oh, this is real true information from the center that's unbiased, and Fox is just like conservative.
Don Lemon's a straight shooter.
Yeah, or CNN is just liberal bull crap. But realistically, that's like complete opposite ends of the spectrum, and there's other stuff in the middle that you should be listening to also.
Yeah, like Matt Taibbi at the Rolling Stone is actually good news. Like, funny enough, right? Like go to the Rolling Stone and you might actually, I think people need to come together and actually like demand good information. Honestly, like, you can fault Trump for a number of reasons, but he hasn't been just objectively like the worst president ever. He hasn't. He's done okay. He's done some things that I think are actually surprisingly good.
I think his rhetoric is complete trash, but I think
his rhetoric is trash. He doesn't
metrics
speak like
wise,
a president.
Yeah, metrics wise, he is definitely not the worst president ever.
He doesn't talk like a president, that's for sure, and we've known that before he was president, right? But that's not new news. The fact that they try to make that new news all the time is annoying. It's like, okay, yeah, Trump said something else. Like, all right, no one cares unless it's like actually geopolitical and has consequences internationally and stuff. And I don't think it's a big deal. If he's in a Twitter war with some random person, like, I don't care. Don't tell me about that, right?
Yeah.
The like China trade deals tweets is kind of like, I don't know about that. If we want international policy dictated on Twitter, but
nuclear war.
Yeah, but like certain things, like, you know, some sort of peacefulness with Kim Jong-un, not a bad thing.
Yeah.
Like I'm not opposed to that, right? Like I can agree with that. I always thought the opposition to Trump's wall was a little bit extra. Like the wall, like, I get it. It doesn't like solve the problem, but it certainly doesn't like hurt the problem. Doesn't make it worse, right? Like, I don't know. I just felt like it was always a little bit like, you're not going to get a wall, you know, like we have to deny you your wall, not like actually reasonable about whether or not it makes sense to have it in some places. You know, there's been a lot of that. And I think it's honestly backlash from the Obama years, right? There was a lot of that on the Republican side, right? Mitch McConnell and them were like, we're not going to do anything with Obama from the very start. And so I think the Democrats have just modeled that, you know, that's what it seems like to me.
And my response to that is that's why we need to get rid of the two-party system.
I've thought that for a long time. Yeah, I agree. I think it would be really great to have a viable third party. Is Rob still there? He's frozen on my screen.
Yeah, I think you froze. Rob, can you hear us? Ruh-roh. I'm going to send him a text.
Anyway.
His video's frozen.
Oh. Yeah, he just dropped off.
Shit.
Anyways, this has been a good conversation, man. I think there's a ton to talk about. It's really just like, what's the issue that you want to discuss, right? Like, our economy is wrecked. Our economy is wrecked right now. And I think some of it's justified and some of it's not. You know, it's like trying to parse that out is really difficult.
Yeah, he said his thing froze up.
Yeah. So I don't know, man. What about you? You're doing law school from home?
Yeah, so we it was like around, I mean, I guess it was probably around the same time everybody else kind of went home. It was like the second week of March. First week of March was the last week of classes that we had in person, and then it was spring break for us the week after that anyway, so we would have been home regardless. But that's when they announced that we were going to go digital, which is weird because the way the law school works is the Socratic method. Like, you go home, read a bunch of court cases, and then go back to class, and the professor pretty much just like grills random people about different aspects of the case and stuff like that. And like, there's not really, it depends on the class, but there's not really like assignments and busy work and stuff like that. You just study cases, do the Socratic method with the professor, and then at the end of the semester you get a final exam, and that's your grade.
Gotcha.
Yeah, so it was strange, but yeah, basically, since we weren't set up for online schooling, what ended up happening, instead of us having like interactive class with the professor, is they just did lectures for like the last month or so of class, and then we took final exams. Yeah, we took our final exams from home.
My other friend's in law school out here at USC, and she was telling me that they like skipped some lessons. It was just like straight up, like, we're not going to do these certain parts of the class. I can't remember which ones it was. She told me a couple specific, like, portions of the curriculum that they just totally skipped.
Yeah, we didn't. It depends on the class. Like, we had a writing class, and it was like part of the class you were supposed to go sit in on like a court. I can't remember what it was. Like, you had to sit in on a court session or something like that and take notes or something. And courts got shut down, so we couldn't do it. So they just got rid of that. And then there was a oral argument. It was a writing class, but after we finished doing all our writing assignments for the semester, we had to do an oral argument with the professor, and they graded us on our oral argument. And but it ended up being like a check the box kind of thing. Instead of getting graded on it, it was just like, did you do it or not? So like, we still had to do the oral argument with our professor, but we didn't get graded on it as if we would have had to do it in person.
Gotcha.
Yeah. So, but for my regular classes though, like the Socratic method classes, like contract law, torts, or property law, stuff like that. Those we didn't cut any lessons or anything out like that.
That's good. Yeah, I don't know. I don't know if it was a California thing or why that happened.
It just depends on the class.
That professor.
It depends on the classes. Yeah, it depends. Like what I was saying is that writing class, they did cut some stuff out of that writing class because we just couldn't physically do it, or they got rid of the grading requirement. And another thing too is that they changed. There's like a grading curve for the like class average is typically around a B. Like, whatever the class average is on the final exam, they make it a B.
Yeah.
So
they curve it. Yeah.
Yeah, they changed that for coronavirus to like an A or A plus or something like that. So basically, like, trying to make it to where it was really hard for people to fail.
Yeah. Makes sense. Damn. It's crazy, man. It's affecting everything. Like, it really is. There's no stone unturned, it feels like.
Yeah, pretty much.
Do you know if Rob's coming back on, or is he done?
I texted him, and he didn't. Well, he said he was trying to get back on. I said, jump back on if you can. He hasn't said anything back. So
okay, I'm gonna use the bathroom real quick. I'll be right back.
I'm gonna use the bathroom too, actually.